All righty, folks, good evening and welcome to our Medical Exercise Specialist Master's Training Series, or our MES Master's Training Series. And tonight, folks, we're going to talk about medical history interviews. The PAR-Q is great, but for your clients coming in with a medical issue and they're coming in for medical exercise training, you need to dig deeper than that PAR-Q, the information is going to give you. You need to find out what happened, when it happened, what's been done for it, what makes it better, what makes it worse. All these pertinent issues regarding their condition. You now have to be a little bit more astute with regard to being able to screen the client. One of the key components is conducting a medical history interview. So Mrs. Jacobs is a 79-year-old female. She was referred after a total hip replacement. Now, she had the total hip replacement left side 4 months ago. It was a cemented implant, but it was done with an anterior approach. She's independent with a walker. She can independently climb stairs, one step over the other. She has a history of congestive heart failure, hypertension, a knee arthroscopy back in 1987, which she also has patellofemoral syndrome. But 4 months ago, she also had a total hip replacement. The medical history is designed to determine the client's current and past status of their conditions. We want to know where they are now with their current condition and if any of those past conditions will have an impact or we need to be aware of with regard to safety precautions and how they may impact the exercise. We want to verbally conduct the medical history rather than just simply completing forms. Please, if you would, listen to your client and visualize what they're telling you in their mind. You know, I fell down the stairs, or I fell out of a chair, or I got hit from behind, or I felt my knee pop when I was actually trying to bend down. Stick to the facts and only the facts. And that's one thing you're going to see this evening with Dr. Thrasher. Clients will give you a plethora of information. All of it is not pertinent, and you have to be polite and professional, weed through it, but you want to get to the facts. Again, the PAR-Q gives us a global history. It is important. The PAR-Q is important. And at some point before or after you've conducted that medical history interview, that you do review that PAR-Q. Our goal here is to identify any serious conditions that may require referral back to the doctor, therapist, or chiropractor, or just simply are outside of our scope of practice. And also with the medical history, we get a chance to clear organ systems. And what I mean by that is we can ask a couple of pertinent questions of a client. It can tell us if they have an issue with their digestive tract. We can determine if they have an issue with their circulatory system. We can determine if they have issues with the bones, or if it's an issue of a joint, or maybe an issue of a muscle. We're going to go through these medical history questions. Number one, what brings you to us? What may I help you with? Okay. Number two, when did this start and how? How do you feel right now? We want to get an idea of where the client is right now. Have you seen a doctor or therapist about this condition? What did they say or do for the condition? So you've seen someone, what did they say or do? And make sure we get an understanding of what each professional said. Next, what has been done up to this point for the condition, including x-rays, MRIs, CAT scans, labs, surgery, medications, massage, other things. Number six, did their recommendations work? So what they told you to do, did it work for a period of time and you just decided not to stick with it, or did it make it worse? What makes it better or worse? Number eight, what are you having a problem doing? Folks, people come to you not because of their pain. They come to you because the pain is limiting their ability to perform an activity. Number nine, how long are you able to perform it or the activity before it becomes too painful? Okay. Next, are you still receiving treatment or seeing the physician or therapist currently? Get an idea if they're still going to the doctor, therapist, or chiropractor for treatment, and make sure that you're aware of when they go, what time of day they go, and that you're not doing anything that will conflict or will basically eradicate what their treatment involves. Number 11, are you taking any medication? Having any treatments or undergone surgery due to this condition? Now, we asked this to a bit earlier, but we want to be more specific with question 11 to make sure we get this out. Number 12, what led you to us? Who told you to come? What were you thinking that you now have shown up at our doorstep? Because let's be honest, medical exercise training or post-rehab fitness is not on the beaten path of most individuals with neurologic, musculoskeletal, cardiovascular, metabolic disorders. This is a new phenomenon. Number 13, Are you continuing to see the same physician or therapist? If no, are you currently seeing another medical professional? Number 14, what are the recommendations for future treatment? So what did they tell you need to do? Did they tell you maybe you need to have a surgery down the road? Did they tell you that you need to have this done? And lastly, number 15, family history is particularly important with cardiovascular. I'm sorry, I have a typo there. Cardiovascular, neurological, cancer, and metabolic disorders. We do see a family history important with clients that have cardiovascular issues, neurological issues, cancer issues, metabolic disorders. We don't see it as much in ACL tears or shoulder injuries or things of that nature, just because of the wear and tear on the human body. So here's what we're going to do. We're going to just conduct a medical history interview. So, Mrs. Jacobs, it is good to meet you. My name is Michael Jones. I'm going to work with you. I'm a medical exercise specialist. So, Ms. Jacobs, tell me a little bit about what's going on with you. How did all of this start? I understand you had a hip replacement. I've worked with your daughter for a couple of years. So tell me a little bit about what's going on with you, please, ma'am.
Well, I had a hip replacement 4 months ago, back in January.
Okay.
And I did some PT. Well, they sent me home to a nursing facility first to get a little bit of rehab before I went home.
Now, I know you are taking medication for your blood pressure also.
Mm-hmm.
Okay. What are you taking for that? Do you remember?
A beta block.
Beta blocker. Okay.
Beta block. I don't remember the name of it.
Okay. And at this point, you're finished with the therapist, you're finished with the physician. I know you got some follow-up appointments with the physician. You told me about your meds. And your daughter is who led you to us, but you also want to eventually get back and start playing tennis again, correct?
That's what I really want.
Okay.
That's what I really want.
So how much exercise do you think she can tolerate in those first couple of sessions? Is she going to be able to do a full hour of continuous heavy duty exercise? We need to tone this down a little bit.
Tone it down.
Tone it down.
If she comes in one day and her knee is swollen like the size of a watermelon, good idea, bad idea for exercise that day for the lower extremity?
Bad idea.
Bad idea. Bad idea. Do you need to get a medical clearance just to get some information on what surgery was done? Yes or no?
Yes.
Definitely do. For the medical professional, I have authority over that client to some degree, or that patient. Look, Mrs. Smith, I don't want you doing that. I don't want you to do this. I don't want you to do that. I don't want you to do the other. You have a different relationship with your clients in fitness, don't you? You want to make them happy. You want to make them enjoy being with you. You want them to come back. I think one thing we're going to have to do as medical exercise professionals is become a little bit more authoritative and say, I don't want you to do A, B, and C. That's it. Because the tendency is they feel better, I'm going to do more. Feeling better and doing more, is that always good for someone with a medical condition? No. So the idea this evening was to give you an idea of how a medical history should be conducted. You see, it's not a difficult thing. It's just simply a simple conversation, asking some questions that are more directed, more specific, to get you a clear picture of what she's able to do. And as we ask these questions with the medical history, that's helping us get an idea of what the client's tolerance level is, what's been done, what the medical community is thinking. And if we have major holes in the history, that's where we go start asking questions.